Hello everyone. It's a wonderful opportunity to speak to you about Hudson Guild's mental health program, where we know you can't have health without mental health. I'm Sarah Kristen, the Director of Mental Health Services at Hudson Guild. Our settlement house has prioritized meeting the mental health needs of our community since 1948 when the program began. Over the last 70 years, the shape of providing mental health services has changed, but the critical nature of the work remains. As a cornerstone of Hudson Guild, the mental health program is available to help community members and all New Yorkers not only overcome challenges, but to thrive. Our team achieves meaningful outcomes by engaging with individuals and families to provide essential therapeutic tools. Our most common interventions are to provide regularly scheduled talk therapy and even medication intervention when needed. These impactful services help individuals alleviate symptoms associated with anger, anxiety, depression, grief, trauma, and other mental health concerns so that they can make progress towards lifetime goals. The impact of these life-changing services may include helping a 4-year-old find a safe and healthy outlet to communicate their feelings, or a 94-year-old find new meaningful connections after experiencing a significant loss. Our treatments work best in conjunction with other services offered at Hudson Guild to help individuals through all phases of life and to reach beyond the individual to their families and community. In addition to the clinic at the Chelsea Elliott Center, our program hosts 2 satellite clinics within the New York City school system. In these locations, our Hudson Guild team members advocate on behalf of and work with children and their families so that mental health does not stand in the way of academic achievements. These school-based therapists have become integral members of their school communities, especially in response to remote learning. Between our 3 locations, we serve nearly 400 individuals and families annually by hosting more than 10,000 therapeutic sessions. Despite the challenges of 2020, we're on track to do the same. Mental health services at Hudson Guild never skipped a beat, transitioning from face-to-face work in our offices and schools to providing telehealth services online and over the phone. There were a lot of questions and unknowns when we held our last in-person, though socially distanced meeting on-site in March. Since then, we have been steadfast and diligent in finding unique ways to reach every participant, sometimes finding a better solution than we had before. Staying compliant with regulations and using telehealth services, our participants continue to regularly meet with our therapists and psychiatrists as if they were coming into the office, but from the comfort of their homes. Participants can use the technology that they have available, whether it's a computer, smartphone, or landline, to receive therapy and psychiatric services. By engaging our participants using telehealth, we continue services without interruption even when life circumstances may change. For example, if someone becomes ill or has an injury and is unable to leave their house, our therapists and psychiatrists can maintain mental health care when previously this individual may have missed appointments and lost progress made during previous sessions. As we head into a period of time that may be marked by additional stay-at-home orders, the mental health program is ready to help our community overcome any collective trauma and stave off isolation. The COVID-19 pandemic and corresponding economic fallout have exacerbated what was already a mental health crisis in our country. At Hudson Guild, it's especially important to provide services to those disproportionately impacted by the pandemic. At the foundation of these services, we have a dedicated and thoughtful team of social workers, psychiatrists, and admin. Each individual team member is crucial to the helping nature of the work, and I want to take a moment to give a heartfelt thanks to each of them. Alexis, Ashley, Beatrice, Dr. Schnapper, Juliet, Katie, Maria, Mike, Dr. Apple, and Vicky, thank you for your dedication to helping others and our team.